Are your stiff ankles preventing you from squatting? Specifically, when there is a loss of dorsiflexion, you'll observe that the knees are unable to track forward. Weight is then forcibly displaced back into the heels, requiring the trunk to drop forward to avoid a loss of balance. The heels elevated squat is a great way to identify if you have an ankle mobility problem. If suddenly you're able to sit down into that squat with an upright trunk, then you've identified that you have an ankle mobility issue. With the heels elevated, the demands for dorsiflexion have been taken out of the equation. The wall dorsiflexion test is a simple tool to assess the ability of the knee to clear the toes. To set up, you're going to position your big toe approximately 4 inches away from the wall. You're going to keep your heel down and you're going to try to drive your knee right into the wall. As your knee is driving forward, you also want to be sure that your knee is not tracking inside your foot. As we descend into the squat, not only do the tibias need to be able to translate forward, but they also need to be able to tilt laterally and internally rotate. When conducting the wall dorsiflexion test, if you feel a strong pull in the back of your calf or down in the back of your heel, this is likely due to a soft tissue restriction. Foam rolling is a great way to temporarily enhance flexibility. The increase in mobility is due to a decrease in neurological tone. This can be conducted within 2 minutes, taking the foam roller and rolling up and down from the calf through the Achilles and holding on any tender spots. Now you want to be sure that you follow this up with corrective mobility work. There are a plethora of ankle mobility exercises you can utilize to appropriate corrective stimuli. Be sure to avoid long holds before athletic events or training. Static stretching has been proven to decrease power output through inhibitory mechanisms when the focus needs to be on potentiation. Static corrective stretching may be utilized after training, but should be avoided prior to. A pinching or blocking sensation in the front of the ankle may be encountered when completing the wall dorsiflexion test. This is typically indicative of a joint restriction. The talus bone needs to be able to translate backward to provide adequate dorsiflexion. A strong resistance band can be used to mobilize the joint. The band will need to be anchored behind you to provide a back and downward force on the talus. This mobilization can be conducted standing with an elevated foot or in a kneeling position. Squatting with the heels elevated or using a weightlifting shoe can mitigate the demands of ankle mobility. Various exercises can be integrated to address mobility loss. Test and retesting the wall and squat tests is a great way to self-monitor the progress and effectiveness of interventions. Ankle mobility is unlikely to rapidly change if this has been an ongoing issue.